to the abducent nerve. Abducent nerve, it's very easy. The names give it away. It's the nerve responsible for the abduction of the eye. It originates from the nucleus, from the pons, abducent nucleus. It is present in the pons, and it has the same three afferent fiber connections from the cerebral cortex, from the medial longitudinal fasciculus, from the superior colliculus, as we have discussed from the last two cranial nerves. It exits from where? It is exiting here. You can see it is exiting from Pontomedullary junction. The three nerves are exiting here: number 6, number 7, number 8. Pontomedullary junction is the medial of the three nerves that are exiting from that area. So it is that. It exits from there. It enters, moves above the petrous bone, enters the cavernous sinus, and it will move through the cavernous sinus. Again, an MCQ point. The other two nerves are moving through the lateral wall. This is the only nerve that is actually passing through inside the cavernous sinus. It moves through the cavernous sinus along with the internal carotid artery. The cavernous sinus relation is very important because these are all the nerves that are affected in the cavernous sinus thrombosis. These are all the nerves that are affected there. And it moves there from there, and it enters the orbit through the superior fissure, and it supplies one muscle, that is abductor, lateral rectus muscle. So what that muscle was doing, actually it was responsible for the abduction of the eye. When that abduction is not occurring, that tone is lost, the medial rectus will dominate and pull the eye towards itself, and that is called medial strabismus, medial squint. So that's all about the muscles of the extraocular movements. Now I will move to the, now it will be a big part of the lecture. It's a big chunk, the trigeminal nerve and the facial nerve, the most theoretically speaking one of the largest ones. So let me take, I have with me time 11:32. Let us take 2 to 3 minute break, stretch your legs, and we will continue from here after 2 to 3 minutes. And if you're seeing the recording, you can simply jump ahead. And if you have any question, you can mention in the chat